question I get from so many of you is, Dr. Hirsch, what if I don't have any symptoms? I'm not having hot flashes. I'm not having brain fog. I'm not even having weight gain. I'm not having any symptoms. Do I need to take anything? Do I need to take hormone therapy? Am I missing out on anything? And certainly I have done a lot of videos in the recent history about hormone therapy, but in today's video, I want to cover 3 things that you should really think about when going through menopause naturally. For those of you that don't know me, I'm Dr. Heather Hirsch, and I'm the program director of the Menopause Clinic at the Brigham and Women's Hospital here in Boston, Massachusetts. And while a lot of what I do in my clinic is talking about or answering questions about the prescription options, there is certainly a majority of you for whom you might not need to see a menopause expert per se because you don't really have any of the classic symptoms. All right, let's start by defining what natural means. Now, natural menopause can mean a lot of things to different people. It could certainly mean on one end of the spectrum, you're not taking any supplements, any vitamins, and you're definitely not using any commercially available products. Natural could also mean for some women supplements, vitamins, or over-the-counter options. So for the intents and purposes of this video here, by natural, I mean you're not going to be using any prescription medications. Now, the asterisk here or the footnote is that, again, if you need something to get through menopause, please, there is tons of resources here on the channel, and this whole reason I started this channel is just because menopause is natural. You know, it doesn't mean that if you're suffering that you shouldn't seek out help. Definitely, that is the entire purpose of what I do in my job on a daily basis. But here, for educational purposes only, I do talk a lot about risks and benefits of certain medications. But there are 3 key things that you need to know if you're not having any symptoms. You definitely don't need to take any medications, but what are the things that you should be on the lookout for? Okay, number 1 is your genitourinary system. So what encompasses your genitourinary system? Well, things that you might think about, like the vagina. However, the vagina is used a lot to say or mean like vulva or clitoris or the external part of the vulva. It certainly could encompass things like the labia minora, and the labia majora. And your genital tract also includes your urinary system, so your bladder and your urethra, where the urine comes from your bladder out to the external world. Hopefully the toilet, unless you're on a run somewhere and you have to make a pit stop. So your genitourinary system really includes both of those components. Now, when we go through menopause, the vaginal tissue changes. And when I say vaginal tissue, I mean that to be synonymous with all the other tissue I just mentioned: the labia, the clitoris, the introitus, your bladder, your urethra. The pH of the vagina changes and becomes more acidic. You don't make the same type of lubrication that you did premenopausally. That's why you can have symptoms of dryness with intercourse, or i.e. pain with intercourse. It's also the reason that you can have urinary tract infections much more frequently after menopause. Because of the changes in the pH, you are more prone to urinary tract infections. So I did a whole video, which I'll link here, on recurrent urinary tract infections and how to treat them. Actually, the treatment for recurrent urinary tract infections can be some form of vaginal estrogen. So I want you to think about your pelvis as a whole as you go through menopause. Now, research shows that about 50% of women experience any constellation of those symptoms: dryness, pain with intercourse, or recurrent urinary tract infections. But I would definitely bet some serious money that almost 100% of women have the physiologic changes in that tissue. Whether or not they experience that symptom per se is arguable, but that tissue is going to change as you lose your estrogen, as you're going through menopause, regardless of the symptoms you can actually feel. So the tissue is going to be different. I want you to be on the lookout for any constellation of those symptoms. Again, be it dryness, pain with urination, pain with intercourse, or even just a different sensation or lack of sensation down there is really, really important. And you definitely should bring this up with your doctor if you're noticing any of these symptoms, if they're recurrent or if they're troublesome. Because again, 100% of women are going to have physiologic changes after menopause. And even though menopause is this transition period, the tissue does not return to normal. And that's because your estrogen does not come back after menopause. And that's what that tissue is really thriving off of. So the first thing I want you to keep track of is your genitourinary system after menopause. And if you're going it natural, make sure if those symptoms are continuing to come up or to be bothersome that you talk to your doctor about it. The second thing I want you to think about is your bone health. Now, I did a whole video here on things that you need to know about your bone health, but estrogen is a huge protector of your bone's integrity. One of the biggest reasons why we lose bone mass is because we lose our estrogen post-menopausally. Now, men don't lose their estrogen. In fact, I usually say to my women who are post-menopausal who come in with a male partner that your male partner now makes more estrogen than you do. And that is true. Men take some of their testosterone and convert it to estrogen and have low-lying levels of estrogen their entire lives, whereas women actually, have a lot of estrogen their entire lives, and then post-menopausally, they really make very, very little, if any, estrogen whatsoever. And so the loss of that estrogen can accelerate the bone loss into the realm of osteopenia, which is the precursor to osteoporosis, which is the diagnosis of a really low bone mass that can set you up for a fracture from a non-traumatic event. Now, this video I did on bone health, which you should definitely recommend, I put it in the cards and I'll also put it in the description bar below. But it's really important to think about bone health because we really do tend to either put it on the back burner or just forget about it because it doesn't get the kind of attention that things like breast cancer and heart disease do. So I really want you to think about your bone health as well. I have a lot of patients who come to me looking for estrogen replacement, not because they have any other symptoms of menopause per se, like the obvious hot flashes, night sweat, or painful intercourse, but they have read that estrogen is really good for their bone health, and that is true. So when estrogen therapy sort of fell off the bandwagon after the initial results of the Women's Health Initiative in the early 2000s, we saw an acceleration in osteoporotic fractures, really coinciding with when we decreased the use of hormone therapy pretty precipitously here in the United States. Now, it doesn't mean that you have to use estrogen for bone health, but again, if you're going through menopause naturally, that's something you want to keep a close eye on is your bone health. Now, many women are really good candidates to get a bone density scan much earlier than what your doctor might recommend, which is age 65. To me, this is really, really too late in the game to be checking your bone density, and I do typically check a bone density 1 to 3 years after menopause, and a lot of my patients have some type of secondary risk factor, in particular family history. Usually, my patients will have either an older sister or a mom or an aunt who had osteoporosis or osteopenia, or many family members afflicted, any type of disorder in absorbing nutrients or vitamins, be it bariatric surgery, Crohn's disease, or any other type of malabsorption issue, certainly any type of steroid use, certain drugs, and there's many, many other reasons why you could definitely qualify to get a bone density much sooner. So the second thing I want you to be on the lookout for when going through menopause naturally is your bone health. All right, so what's number 3? And this is a big one. The third thing that you want to think about is your cardiovascular health, and wrapped up in there is things like your blood pressure, your insulin resistance, or your A1C, and your metabolic syndrome, which would also include your weight and your cholesterol. Now, the American Heart Association actually recently came out with a statement at the end of 2020, really sort of declaring that menopause itself, the transition through menopause itself, is a novel risk factor for cardiovascular disease. And that is because when we lose estrogen, there's a lot of physiologic changes that happen, and estrogen does seem to be actually quite cardioprotective. For example, when women take estrogen within the first 10 years of menopause, they're shown to have reductions in heart attacks and reductions in all-cause death. And, you know, the leading cause of death in women is by and far heart disease. So we certainly see reduction in heart disease. Now, I did a whole video here. This is a really great video I did on the heart benefits of estrogen therapy. Again, not that you need to take estrogen to have benefits in your heart. It just means that, again, your body is going to change after menopause. It's not going to be the same. Even though menopause is a transition, you know, society tells us it's 1 year. In reality, it's really 5 to 7 years. But once you go through that transition, you're not the same you were when you were premenopausal and making estrogen. Your body is completely different. And again, you are more prone to things like high blood pressure, prediabetes, diabetes, cholesterol issues, and weight gain. So you want to keep a really close eye on those things. So here's a quick list of blood pressure targets and other cardiometabolic targets. So normal blood pressure is a blood pressure of 120/80 or lower. Hypertension is a diagnosis of blood pressure on more than one occasion of 140/90. Now, white coat hypertension, which is something a lot of my patients do have, is that your blood pressure goes up when you go to the doctor's office. And more recent data is coming out showing that actually that is really true. And your blood pressure, the actual blood pressure average measurement that you have, is really more like what your blood pressure is at home and less like what your blood pressure is when you go to the doctor. So if you've ever, wanted to get a blood pressure cuff or measure your blood pressure at home and your doctor suggested it, it's a really great thing to do because actually your home blood pressure measurements are much more accurate. So keep a close eye on your blood pressure. Another thing you want to check is your A1C level. You want to try and keep it out of the pre-diabetes range and the diabetes range. So at an A1C of 6.5 and greater, you're getting into the diabetic range, and about 5.9 to 6.4 is your pre-diabetes range. And again, that insulin resistance, the way we metabolize sugars, certainly changes after menopause. And so again, that really can make us more prone to either pre-diabetes or diabetes. So keep a close watch eye on that number. Your cholesterol, of course, that always gets a lot of, it's a fan favorite, right, at your annual visit. What's my cholesterol? But watch it. It doesn't mean that everyone needs to go on a statin. Really, there is a great place for diet, exercise, and lifestyle changes. So just monitor your cholesterol and your weight. Again, metabolism changes, and that's why a lot of these parameters, blood pressure, A1C. So if you're going through menopause naturally, meaning not using any medications, hopefully you don't need them, because if you do need them, I have a whole video here on the safety of hormone therapy. But if you're asymptomatic, you're not missing out on anything. But do watch that genitourinary system, your bone health, and your cardiovascular markers. If you guys loved this video, please check out some other things from me. I have my own podcast, Women's Health by Heather Hirsch, where I actually do totally different content over there, and you get to know me on a more intimate basis. I invite a lot of guests on, and it's a really fun place to be. So new episodes, again, come out Wednesdays, and I will drop the link to the podcast down below. I also have my course, The Complete Guide to Menopause. If you want to take a deep dive into all of these issues, definitely check it out. And I also have lots of mini courses along the way. Thank you guys so much. If you like this video, give it a thumbs up, subscribe to the channel, because that tells the algorithm and other women who are searching for all things and answers to questions about midlife and menopause, the cholesterol and weight, they all kind of go together. So watch those trends really closely. The up and up that this channel is really where they can get some evidence-based information. I will also drop a link to the American Heart Association's scientific statement that I talked about earlier in the segment down below, and you can check that out as well. Thank you guys so much for sticking around, and I will see you in next week's video. Bye, everyone.